hali ya maisha imeenda juu sana.
Komiti mar Senate manono chenro mag thieth kotelnegi kod Senator ma Uasin Gishu Jackson Mandago koro dwaro ni ten county ma Bomet oler gino momiyo nitiere dhugruok mar jotuo e od thieth ma Longisa County Hospital. Ka giloso e od thieth kanyo, jokanyo mag kamiti no wacho ni kata obedo ni chenro mar thieth ber, jotuo podi oriwore e kitanda nyaka mine mapeka. Tok limo od thieth ma Longisa, kamiti no bende oromo kod Governor Hilary Barchok e log tich mar county no.
We are here as the Senate Health Committee to inspect Longisa Level 4, was supposed to be operating as Level 5 facility here in Bomet. And as a Senate Health Committee, together with the County Assembly Health Committee of Bomet, we have had a joint inspection of this facility just to look at the services, how they are being offered, but also to look at and discuss with management of our facilities on the challenges they are facing. We've seen in the wards that have supposed to ordinarily have a capacity of about 64 patients, having patients close to 100, 90, 100 and something, and therefore there is need to expand this facility. We have also seen the issues of drugs and non-pharmaceutical management, and I think we have noted an issue of concern here that there is need for proper maintenance of records for purposes of tracking and even for purpose of ensuring logistically in terms of procuring, there is data available that can be used for that decision making.
Tumeona ndio kuna pungufu chache, hasa kama kina mama ambao wamejifungua wanatumia kitanda kimoja, akina mama wawili pengine watatu. Hiyo ni changamoto ambayo tungependa kuwa iangaliwe, kwa sababu watoto ambao wanazaliwa ni viongozi wa sasa na kesho ambayo inakuja.